What hospital care should I expect for status epilepticus? When someone arrives at the hospital experiencing status epilepticus, quick and thorough care is essential to stop the seizures and prevent serious complications. The process follows a clear plan that includes stabilizing the patient, diagnosing the cause, treating the seizures, and ongoing monitoring. First, the medical team assesses the airway, breathing, and circulation immediately. They may give oxygen, manage the airway, and start intravenous fluids to keep the patient stable. Continuous vital sign monitoring begins right away, including checking oxygen levels, blood pressure, heart rhythm, and oxygen saturation. A quick neurological exam is performed to evaluate consciousness and neurological function. Blood tests are drawn to check electrolytes, blood sugar, kidney and liver function, and levels of any anti-seizure medications. If the patient is of childbearing age, pregnancy testing is also done. If blood sugar is low, it is treated immediately with intravenous dextrose to prevent worsening seizures. The next step involves controlling the seizures. The first medication given is usually a benzodiazepine like lorazepam, administered through an Raman-Fa. If seizures continue, a second dose may be given within minutes. If seizures persist despite benzodiazepines, doctors move to second-line drugs such as phosphonidone, valproate, or levetiracetam. For seizures that do not respond to these medications, continuous infusion of anti-seizure drugs may be started, often in an intensive care setting. Treatment with intravenous medications generally lasts at least 24 hours after seizures are controlled, before gradually reducing the medication. Monitoring continues with continuous electroencephalogram monitoring, especially if the patient remains unconscious or seizures are ongoing. This helps detect non-convulsive seizures that might not be visible. Imaging tests like computed tomography or magnetic resonance imaging scans are performed urgently to find underlying causes such as stroke, trauma, infection, or tumors. Sometimes a lumbar puncture is needed if infection or inflammation is suspected. In certain cases, intracranial pressure monitoring might be necessary. Patients with difficult-to-control seizures often requiring admission to an intensive care unit for close observation and advanced support. Neurology or epilepsy specialists should be involved early, ideally within the first 24 hours, to guide ongoing treatment and investigate the root cause of the seizures. If specialized care or continuous EEG monitoring is not available locally, transfer to a specialized neurocritical care center is recommended. Long-term management includes continuing pre-existing anti-seizure medications at full doses, checking medication levels, and adjusting therapy based on the patient's response and diagnostic results. Supportive care is also vital. Airway protection and respiratory support may be needed if seizures impair breathing. The team monitors for complications such as aspiration pneumonia, metabolic disturbances, or irregular heart rhythms. For women of childbearing age, fetal monitoring and obstetric support are important. Overall, hospital care for status epilepticus is a coordinated effort that aims to stop seizures quickly, prevent brain damage, and reduce the risk of death. It involves rapid stabilization, stepwise medication treatment, continuous EEG monitoring, thorough diagnostics, and expert involvement to ensure the best possible outcome. Always remember, each case is unique, so personalized medical advice from healthcare professionals is essential.